There has been an uptick in something called respiratory syncytial virus. These are cases that are being found in infants, and health authorities are saying that COVID could be partly to blame. It's an illness that can be very serious for infants and in some cases result in hospitalizations with severe symptoms. So joining us now to tell us more about what's causing this is Dr. Hansa Bhargava. She is a pediatrician and senior medical director at WebMD. Good morning to you. Nice to see you this morning. Before we get into causes for this, let's just start with what exactly is RSV?
Yeah, absolutely. So RSV is actually a common virus that surges generally in the fall and winter time. And for most adults and kids, it looks like a cold. But for babies and younger infants, it can actually cause serious infections like pneumonia, and actually can cause death and hospitalization.
Well, which is very frightening to hear for parents. What are the signs and symptoms? What should they be looking for?
Yeah, absolutely. So for younger kids, it can look like a cold, it can be a cough, and it can result in wheezing. In infants and younger toddlers even, you could actually have wheezing that leads to respiratory distress, and then they can't really breathe very well. Now, the thing I would absolutely point out is for adults and older kids, it can just look like a cold. So unfortunately, that means you would come back home with a cold, or a child may come back from camp with a cold, and that could infect a younger infant in the household. So I would just remember that.
Okay, so then the question is, what can you do to prevent it? Is there a vaccine for this? What can you do to make sure that is not brought home to your infant?
Yeah, absolutely. So the reason we're seeing the surges right now is because during the winter time, we had masks on, social distancing. So normally it spreads in the winter, and now it's spreading now. So that makes logical sense. What we can do as parents is actually make sure the older kids have good hand washing. If you or an older kid in the household actually has a cold, make sure that you don't get near younger infants. And if you do, wear a mask like we're all used to doing. And lastly, just be very careful if there is a cold in the house and the infant starts having symptoms. If it's getting worse or it lasts for more than a few days, reach out to your pediatrician, because it could be much more serious for the infant and also older adults.
Yeah, so don't mess around. You know, it's interesting, as I said, alluded to at the top here, that COVID could be partially to blame. Explain this, because I think a lot of people are seeing that they're coming down with different things right now that they hadn't been because of the fact that we were wearing masks all the time.
Absolutely. And so generally speaking, RSV surges in the fall and in the winter, as does the flu. And so for RSV, it can be responsible for over 58,000 hospitalizations in kids and even several hundred deaths. But right now, because over the fall and winter this year, we had masks, we were social distancing. So the spread generally happens from cough, or wiping your nose and touching other objects like older kids or younger kids often do. And we didn't see that this time because we didn't have the schools and we didn't have anything in session really. But now that we're seeing those activities and camps and lots of crowded events, and if you've been to an airport recently, you see how crowded they are. Now we're seeing that spread. So it makes sense that it's spreading. We just have to be really careful about exposure to the vulnerable population like younger kids or older than 65 adults.
You know, I have to ask you this too, because as we talk about this and kids are going back to school in the fall, and the big question to mask or not to mask, what is your recommendation to parents because of those children going back, not only for their safety, but maybe they have an infant sibling at home? It's a very confusing time right now. What's a parent to do?
Absolutely, and it's a great question. We all, as parents, we all have anxiety about going back to school, about that, and also just school stress in addition, so it's a lot. I would strongly suggest that kids over 12 get vaccinated. That is the best way to protect. In fact, the surges we're seeing with the Delta variant right now are mostly in the unvaccinated, as are the hospitalizations and deaths. So the vaccine really does protect you. So for under 12, absolutely have the kids wear masks indoors or in groups where you have a lot of people. It's really, really important to stop that spread of COVID, influenza, and even RSV. So the masks and social distancing are still important in our unvaccinated kids. And lastly, the AAP has recommended masks for every child, vaccinated or not, and that's because it makes sense to do that, because the teachers cannot be the administration, school administration can't be having that burden of, policing who's vaccinated and not. So the safest way to get our kids back to school is to have everyone vaccinated. And the AAP and myself as a pediatrician and parent feel like the schools are so important for the kids, right? Not only for the learning, but also the mental and emotional wellness for them.
Absolutely. Dr. Hansa Bhargava with WebMD. Thank you so much for your advice this morning. We appreciate your time. Have a great day.
Great to be here. Thank you.